Okay. So here, 12-year-old child, I think she has already told it 12 times. So I need not tell again and again. Microspirophakia, you see the condition of the lenses here. And still she wants to put those iris hooks, what all hooks she wants to put it, place it in the bag and make it non-mutilating. But she did not think what it falls down. What later on it falls down, who has to pick up? Shrinivas Joshi.
तो नीचे बैठे रहो आप.
So what is the classical triad? Lenticular myopia, small spherical crystalline lens, angle closure glaucoma and variant. Now this is, Dr. Deepti, you know what is this? This is the Superman soldier serum, right? From Steve Rogers in the Captain America movie, where this poor guy, he wants to join the American military. So the scientists found out that give a serum, SSS serum, so that he became like this and he went into the World War. But my dear Deepti, this is all film. This is, so what's the inventory you have? You have any inventory for this? The only inventory she has is SSS, that is Shrinivas and nothing other than Shrinivas.
You have somebody else?
So the clear lens extraction and the intraocular lens implantation in the case of microspirophakia, I think I should say that God bless all these people who have done these studies and all these mutilating surgeries, try to bring it to the center, use rings, hooks, all whatever. They all should be in the drama, circus, not in the real life. Capsular hook assisted implantation of modified capsular tension ring. Please read this. MCTR rotation into the back was fraught with repeated adherence of the advancing end of MCTR into the loose back, causing simultaneous rotation of the bag itself. छोड़ दो यार, lens छोड़ दो, bag ही rotate होता है. And this is again said by none other than our own Dr. Sudarshan Khokar. This is one of the very famous case reports, case series, what he has done. And look at the single eyelet. They said that the authors did not employ two eyelet because they thought the technique was difficult and less repeatable. Look at this, the clinical spectrum surgical outcomes in spirophakia. They also did all the procedure, which unfortunately my wife is still trying to do that. But what is the result? However, the author still favored the anterior chamber IOL. Oh my God. So he was so much away against these hooks, rings and bringing it and try to fear that the lens might fall down. So this was said by Deepti in the recent March 8th. That is the Women's Day. Gender equality today for a sustainable tomorrow. That's the theme for Women's Day 2022. And she addressed our 300-400 employees with this great saying. Gender equality. But this doesn't mean that I respect gender. I agree. But that doesn't mean that I cross my boundaries. If a case of this happens, like this, I doesn't put a buckle under the lateral rectus and try to restrict that muscle so that it becomes an orthophoric. No, I don't try to do that. I am a vitreoretinal surgeon. I am a happy surgeon. I try to send these cases to Deepti itself. So one has to know their boundaries, should not cross the boundaries because it is gender equality. So this is phacoemulsification. अरे यहाँ तो बोलने दो भाई, यहाँ तो बोलने दो. Phacoemulsification combined with supracapsular as scleral fixated intraocular lenses. My dear wife said that, okay, he does that, but the capsule can still be preserved. You can always retain the capsule because the SFIOL entry happens through the anterior route. You can always rest the SFIOL on the anterior route. Now, where is the problem of tilt, astigmatism, field, rotation? कहाँ आता है? Capsule पर ही रख सकते हैं ना? तो tilt कहाँ का आता है? These are again, there are various authors can do that. So one thing I finally realized, I want to tell it to my wife, that whenever there are certain things, whenever it comes to our patients, there should not be an ego. Because your ego is not your amigo. Your ego is a constant filter that is distorting your reality and providing you the bad information. It is like wearing a pair of prescription glasses that are unfortunately wrong prescription, my dear. They're wrong prescription.
So you learn the reflection now.
So I cannot use this word. Of course, I don't have the audacity to use that word. But the great saint, everybody follows him. What he says? That the ego must be obliterated. In any such cases where it requires a VR intervention, when she has a husband who is a VR surgeon, where comes the ego to refer those cases?
So you should.
Your Honor, I rest the case to the fine sense of your judgment.
Yeah.
Thank you very much.
Yeah, rebuttal.
Sir, alternative, what she was telling, sutureless, glueless and all less, na? This is nothing.
No less.
This is nothing, very simple technique. If she wants, she can come, I can teach her. The ego again should not come in between the pediatric surgeon, glaucoma surgeon and the vitreoretinal surgeon. Sir, basically we are all
So
surgeons.
try to be
sir.
friendly at home.
We are all surgeons. See her. She's a good homemaker. She's a good housewife. She's a good daughter. She's a good this thing, that, Balwan, everything. Everything is there here, sir.
श्रीनिवास किसको देख रहा है?
I'm folding my hands to my wife. She's a good speaker. She's a homemaker. She's intelligent. She's that. She's this, everything.
So
But
what
the
she's
only
not?
thing I tell her, please don't sacrifice our patients. Please. God bless you, Deepthi.
Who else saw Netaji Subhash Chandra Bose and Shrinivas this evening? Rebuttal, Dr. Deepthi.
So with the rebuttal, he said yes, everything is done. This is इसको attach कर दीजिएगा तो. No, one slide I have for rebuttal also.
Yeah, he will attach it later. Now you detach.
Project for.
Come with you. Acha,
Opponent G.
Sir, उन्होंने इतना
श्रीनिवास
respect
जी.
मुझे ऐसे किया है तो
This
मैंने
good,
भी
good,
respect दे
good,
दिया है.
good,
So-
good.
So now, last one point. He said everything, yes, done. So then, yes, there is sutureless, glueless, all less, this less, that less, but what about the learning curve? This is SFIOL and the VR. So doing our surgeries, everybody in this hall can do my surgery, but very few people
No.
here can go ahead, can go ahead and
No,
do
I agree.
SFIOL surgeries. So with
everybody in the hall can
Not do
fix
well
a bag
matches,
with multiple rings. And
Sir, yes, I think. So with this, I think the end is very clear. This is me and this is him.
Srinivas, respond.
So
This
you
is
are
not
holding
me, this is-
Superman or you are holding Vivekanand?
Lastly, एक point अनुराग भाई.
Irshad.
Common sense is something which everyone wants, Anurag bhai. Common sense is something which everyone wants. Few of them have, but Deepthi
She is super common.
and one famous author has said, common sense has now become
Very
an
uncommon.
endangered species. And thank you
So,
very much.
Srinivas, do you know how to cook?
Yes, sir. When I say yes, sir, it is yes, sir.
Okay.
Yes, sir.
Is he saying the truth?
No, he can cook.
He cooks
No,
to
no.
survive.
He can make Maggie.
No. I can make certain South Indian dishes which I have learned. sir.
Which are not known to you.
All right, Dr. Kelka. Out with your comments.
Yeah, excellent debate. And now that you can cook, I think you have a new chef in the house because I give full marks to Dr. Shrinivas. हाँ? को करेंगे नहीं.
So he had learned in this short time.
Do we have a session? Do we have a session after?
No.
नहीं
I
कह रहा
don't
इसके
think
बाद
they
ये
have
हॉल
such-
को क्लीन करेगा. अभी हाउस ऑन फायर है ना.
All right. Then we need to hurry.
I think
because
I'm
we
with
have-
Dr. Dipti because in pediatric cases we have to put the IOL in back. And I have seen my husband managing so many microspherophakia cases with
The
fixation
Srinivas
of the
up on
back.
stage, please.
So she says that the males are required to maintain these kind of things. But I feel females are good and master to use hooks, rings and tighten something. But I think doing it through posterior route will make science. That is my thing. No, the reason is that doing wheel Marchesani syndrome cases, the bag itself is almost touching the cornea. the chamber is not there, and you said already secondary glaucoma was already there, means them some other damages were already there, and you said we don't know the longevity of the sutures. In these patients, you will require them. You can't do without that. So that was the part truth not given to the audience.
All right,
So
we
I
must-
think doing it through the posterior route will
must
make
hurry,
sense.
sir.